Thanks for joining us. I'm your host, Raquel Faria. I'm an internal medicine consultant at the Centro Hospitalar Universitário de Santo António in Porto, Portugal. Today, I'm joined by Professors Ricard Cervera and Sandra Navarra from the Lupus Academy Steering Committee. Between them, they will be providing expert insights from the 12th annual meeting of the Lupus Academy meeting, which they shared in Barcelona in early September 2023. Ricard, Sandra, welcome, and thank you so much for joining us today.
Thank you very much, Raquel, and greetings from Barcelona.
Thank you very much for having me and having Ricard as well to talk on this. It's an exciting thing to talk about Lupus Academy and how it has evolved through the years, especially in terms of scientific content.
So, and Lupus Academy inaugural meeting was 11 years ago, also in Barcelona. Ricard was one of the organizers with Roger Levy at the time, and both of you were and are part of the steering committee from the very first beginning. As a frequent attendee of Lupus Academy, I must thank you for keeping this amazing education program on lupus going on through these years. Before starting the discussion about the presentations of the meeting, I'd like to know what was your general view of this meeting and all the meetings, and how do you think it has evolved during the past 12 years? Ricard, can you start, please?
Yes, thank you, Raquel. We have really done a lot of things over these 11 years. The first thing is that we started with 6 steering committee members, and nowadays we are 12 steering committee members from all over the world, Europe, the States, Latin America, Asia Pacific region. And over these years, we have done every year a main annual meeting. We have been, in addition to Barcelona, we have been in Buenos Aires, in Berlin, in Rome, in Amsterdam, Lisbon, Rio de Janeiro, Warsaw, Florence. Also, during the pandemic year, we did a only virtual meeting. But in addition to these big annual meetings, we have done 10 additional regional meetings, usually of a small size, but also very interesting. We have done this in the Philippines, in China, in Budapest, in Belgrade, Dubai, Paris, London, Asunción in Paraguay. And also we have started producing e-learning courses, podcasts like this one. We are also in charge of the EULAR online course on SLE. So we have done a lot of educational activities. Mm-hmm. And also it is very important that also the main annual course has been enlarged to the traditional state-of-the-art lectures, workshops, one of probably of the most interesting part of the meetings, and the debates. We have recently added sections on thieves market, where people participating in the meeting from different parts of the world present their complicated cases, and also the section on lupus around the world, where people coming from countries where usually we don't have too much information on the epidemiological aspects of lupus can present the epidemiological knowledge and the epidemiological results in this main Lupus Academy meeting. So plenty of things over these 11 years of history of the Lupus Academy, for sure.
Sandra, do you have a similar or different insight of all the evolution that Lupus Academy has?
Right. Thank you. Thank you for that, Ricard, and giving an overview of Lupus Academy through the years. One of the interesting highlights, and I thought it was new, it was novel, and very, very relevant for this year's Lupus Academy meeting was, yes, you mentioned lupus around the world, outside of US and Europe. And that was interesting for them to share also their not only epidemiology, but also the cases that we have. they have in their own countries or in their own regions. And the other thing is that was also interesting with this, as I thought was a very, very important highlight with Lupus Academy. It is not just for physicians, it's not just for patients who treat or physicians who treat lupus patients or lupologists, but is definitely it is the patient should be at center stage of what we are doing in terms of lupus education.
Thank you, Sandra. As you know, I'm a Lupus Academy frequent flyer. I've missed only Argentina and Brazil. I attended 10 of the 12 annual meetings. And I must say, attending Lupus Academy has helped me grow as a lupologist. I always thought that this meeting has the perfect size. So we attendees can hear the minds of experts while you discuss different details of the clinical practice that are doubts for everyone and controversies for us all. And with the workshops, I think they are even closer, so we can discuss even more detail and learning. So to visit the program of the meeting this year, we will go a little bit through the program and to hear what you both highlight from different discussed points. So one of the most discussed thing in lupus for the past 2-3 years is disease modification and damage prevention as the main goal in the current management of lupus. Ricard, there are several presentations on these, and can you highlight what were the most important points raised about this in all the meeting?
Yes, certainly. This is a key point nowadays in lupus, is the introduction of the concept of disease modification in lupus. This is a concept that was already introduced in other areas of medicine in the recent years, and that they have certainly contributed to the better management of those diseases where the concept has been introduced. Also in the field of autoimmune diseases, for instance, in rheumatoid arthritis. And the main idea is that these chronic diseases, such as lupus and other autoimmune diseases, and all autoimmune diseases, the main goal should not be just to control the disease activity in a given moment and to relieve the symptoms in a given moment, but to prevent the end-stage damage, because this damage will produce more damage and this will produce more mortality. So nowadays we know that this modification of the disease to prevent organ damage is essential in the management of lupus. And we now know that this damage is produced not only by the disease activity itself, but also, and this is very important, it is produced by the drugs. But many of the drugs that we are using, especially glucocorticoids and some immunosuppressive drugs, they also produce damage, and also comorbidities. And some of these comorbidities, for instance, infections, are also depending on these drugs, on the use of these immunosuppressor drugs. So to introduce this concept was of paramount importance. So we included several lectures to develop this concept in lupus from the top experts on the field, Mari Ourovich, Ron van Vollenhoven, and others. And we certainly expect that with the dissemination of this concept of disease modification over the years, we will have also better outcomes, better survival, and better quality of life for our lupus patients.
Actually, during the meeting, was not only discussed the disease modification concept in general lupus, but also in lupus nephritis. How do you think this applies to lupus nephritis also?
That's right. Manuel Braga also applied the concept of disease modification to lupus nephritis. In this case, the organ damage is called end-stage renal disease, And this is something that for nephrologists nowadays is really essential. The concept or the idea is the same, not just to decrease lupus nephritis activity in a given moment, but also to use drugs that don't increase the organ damage, mainly high doses of steroids and classic immunosuppressive drugs, and to prevent also the comorbidities in order to prevent this end-stage renal disease. The good news is that for both lupus in general and lupus nephritis, nowadays we have already some new drugs that probably are disease-modifying drugs, that they decrease the organ damage over the years.
And actually we came a long term, since for lupus nephritis 2 or 3 decades ago, hydroxychloroquine was not even used because it was thought to be just for milder lupus. And now we have not only this concept, but also some other drugs that are so safe that can also be used for modifying disease. It's very good and challenging times to treat lupus. But actually, on the real world, we have some more practical issues implementing these. And we learned also how to accomplish these goals, not only with the biologics that have been so discussed, but also how the main strategy how to optimize steroids, because we still need them, and other steroid-sparing drugs. What have we heard on these meetings? Sandra, can you please comment a little bit on this?
Yes, absolutely. We need to optimize steroid-sparing drugs, because as the biologics, new medications come in, one of the objectives for having all these drugs, new drugs come in, is to lessen the damage that we have, not from the disease, but damage due to medications, especially corticosteroids. So it is an important aim of management in every patient to try to lessen the medications or side effects or damage produced by corticosteroids. The presentations of the new medications, biologics and other medications, and also emphasizing how we need to have hydroxychloroquine as a base medications for all patients with lupus. The aim there is really to lessen the need for steroids of these patients during the management, and long-term to prevent. It's not just to lessen, but to prevent actually the damage caused by corticosteroids. So that was emphasized throughout the meeting, especially in the presentation of new drugs, in order to have steroid-sparing ability for these drugs.
Ricard, do you want to comment on the strategy of optimizing steroid-sparing drugs?
I fully agree with Sandra's comments, and I only would like to stress something that one of the presenters of the meetings, Guillermo Ruiz-Irastorza, also stressed. The main person that has the responsibility to decrease the dose of steroids is the doctor, is the physician treating the patient. The steroid-sparing drugs, modern biologics, or classic hydroxychloroquine, certainly will help. But the person who must decide, go down with the dose of steroids and monitor closely this patient, is the physician. Still, we sometimes give a given dose, maybe 30 milligrams prednisone to the patient, and come back here in 1 month or in 3 months. And it is necessary to decrease this dose of steroids and to probably put just an agenda to the patient to decrease. In 2 weeks, you must decrease. In additional 2 weeks, also, you must decrease a little bit more, and so on. So it's a responsibility of the doctor, and this was clearly stressed during the Lupus Academy meeting, to monitor this decrease in the dosage of the steroids.
Thank you. There was also, as Sandra was mentioning, the new therapies and the approved biologics for SLE was a topic of discussion. And now that we have 2 approved and 1 that is used even off-label, like rituximab, which to try first and in which patients? Ricard, what did we hear about this?
Well, this was the opening debate. We like to have an opening debate always at the Lupus Academy. And in this case, this was between anifrolumab and belimumab. And we have the great opportunity to have some of the top investigators on these drugs, Eric Moran, who presented anifrolumab studies, and Ron van Vollenhoven, who presented belimumab studies. Actually, it is still not possible to answer this question, which and when, because we don't have enough knowledge to answer this question. We don't have head-to-head trials. We don't have large experience over the years in real life in the more recently approved, that is anifrolumab. We have from belimumab, but not from anifrolumab. So it is probably not possible to answer this key question, which and when. But what we have, the good news, is that we already have 2 approved biological drugs, plus 1 non-approved off-label, but it's widely used, which is rituximab. And this is good news for our patients.
And actually, not in every place in the world this is available. So the discussion about optimizing steroids and steroid-sparing drugs was really important, so we can cover all the lupus patients in the world. And infection was also a worry in the discussion. And mainly after discussing belimumab and anifrolumab, and it really applies to every immunosuppression in lupus patient, one of the worries was herpes zoster, and mainly because there is a vaccine that is available in some countries. Ricard, can you please comment what was discussed during this session on herpes and vaccination?
Well, this was a topic that was also presented by Richie Fury in the opening ceremony session. And certainly after the advent of anifrolumab, it has been found that at least at the beginning, during the first year of the treatment, there is a slight increase in the risk of developing herpes zoster. And as we have in parallel the good news that we have a good vaccine that is safe for our lupus patient, the final recommendation was that all patients with lupus should be included in the list of patients to be vaccinated with herpes zoster, in addition to, at this moment in many countries, elderly people under immunosuppression, people with malignancies, but people with lupus and also probably most other autoimmune diseases also should be in this group of where the vaccine should be indicated.
That is a worry, and since that it have been discussed, the first-year risk of zoster when using anifrolumab, it was really highlighted, but we need to see more patients. The burden of the immunosuppression that the patients have done before entering the trials is also a big issue to take in account when you choose these drugs and when to vaccinate. Thank you, Ricard, for that. On the first meeting, or the first day of the meeting, which was online, Eloisa Bonfa discussed the challenges in the development of a universal lupus patient charter, and this is really a challenge. And I was amazed to see all the things that she covers. Sandra, how do you see this idea, this challenge for universal charter? And can you please briefly comment on the most relevant points of her presentation?
The Universal Charter, as you know, it's a charter. It's a patient. It's a charter for patient care, for lupus patient care, in order to not standardize, but to create awareness and also strengthen patient awareness and education, standardize care for these patients, so that it will not look like you just treat a lupus patient the way you'd like to treat the patient. So, and we also, the charter is important. So before even addressing the challenges, standard care, standardized care, patient awareness and education. We have talking about healthcare, professional awareness and education, socioeconomic, which is so important, socioeconomic and
Yes.
ethnic differences. And of course, the stakeholder engagement, because many of these drugs, if you need to give medications to these patients, but patients couldn't afford them. So you need also where to get the resources. And importantly is research and data collection, because we will never hear the end of lupus. And the lupus keeps growing every time in terms of the challenges. So it is important to have some kind of a guide or a charter for patients. It's a patient charter. But then, of course, the challenges of developing such a charter is always, if you have to have the whole globe with the diversity of peoples, diversity of cultures, that is one of the challenges here. But at least we have to start somewhere. And that was what Aloysia Bonfa was trying to guide us into the development of a lupus charter in terms of standardizing care throughout the world, which is why it's called Universal Charter for Lupus Patients.
And actually, we had another presentation during the meeting that had something to do with this challenge, which was Laurent's one. And it talked about the disruption of lupus patients' pathways and how this is different and what we could highlight to optimize in the real world challenges and unmet needs for lupus. Sandra, can you please comment on this issue?
It was a,
and
yes,
the presentation?
It was a very, very interesting presentation because it just brought home, look, we are discussing all these new drugs, but what about the pathways from diagnosing a patient to the treatment of the patient to the follow-up of these patients? It is highly individualized, and we all know the challenges there because every patient is different. So each patient is different from another patient, even if they have the same diagnosis of lupus. So highly, highly individualized. Now, and then we have also a relative shortage of lupologists, regardless of the subspecialty, but patients who know lupus, who know the heterogeneity of lupus, and who realize that it is a highly individualized approach to treatment, to diagnosis, treatment, and follow-up. So the timely referral to general practitioner, creating a network between the general practitioner and this lupus specialist, and communicating the diagnosis of SLE to the patient, adherence to treatment, those are all the challenges. And there are so many gaps as of now, but at least if we know these challenges and unmet needs, then we know how to go in terms of creating a convergence between what is traditional medicine, maybe stratified medicine, and eventually precision medicine. So putting all of this together to treat an individual patient. So that is, it's an important step, even if we are just at baby steps on this, but that is so important to start on, especially in the field of lupus.
And this is so different between different sides of the world. And actually, we can only try to change things if we know what's our reality. And this obviously implies the patient. And we had the opportunity to hear Jeanette, the chair of Lupus Europe, on the patient's perspective. And actually, Jeanette has more than the patient's perspective. She has a representation of the patient's perspective. And I think that I always think that when we hear patients telling their stories and the way they see it, we learn, and we learn how to be better physicians in this disease. Sandra, can you please highlight what you thought was the most relevant points of
Absolutely. And I think that's one of the highlights of this year's Lupus Academy meeting was on patient-centeredness, which is what every lupus patient deserves. So that is where we have the concept of shared decision-making between the patient and the physician. It is so important to listen to the patient. There are disparities between what the patient feels, thinks, and perceives, and what the physician perceives. There's so much literature on that. There is a disparity. There is a disconnect between the physician and the patient. So we need to fill in that gap with the concept of shared decision making, and that was emphasized by Jeanette in her presentation. And there's actually Marta Mosca also had a presentation on this in terms of the European Reference Network. So it's not just lupus, but they started with other diseases and then went on to enhance and strengthen patient partnership. And one of the chairs of whom is also Jeanette in that particular committee on patient partnership for the ERN Reconnect working groups. And the aim of this is to enhance again patients' partnership with the physicians, with all the other caregivers, with all the stakeholders. But Reconnect, ERN Reconnect seeks to actively involve patients as well as empower patients by giving them an active role in this network, in this European Reference Network. So that is very, very important. And if I may add, also looking at that, so I was so amazed actually at the role even of not the physician, but the role of not the patient, but the role of the nurse. There was one session or one presentation by the rheumatology nurse.
Ada.
Her name was Ada.
Ada. From the
Ada.
UCLH lupus clinic, yes.
Yes. We know that the lupus is it's not a one-time, big-time disease wherein you have a diagnosis, you give treatment, and after that you're cured. No, lupus is a chronic disease. You have ups and downs. It waxes and wanes, and patients who are usually not physicians do not understand their disease in terms of pathophysiology, in terms of medications, in terms of science. What they have is what they feel. So what they perceive from their own lay perspective, non-physician perspective. So the rheumatology, a dedicated lupus nurse, will be able to help fill that gap in terms of education. So it is empowering the patient. The busy rheumatologist or the busy lupologist who treats the patient will not have time to explain and go to the other ramifications of patient management and the details, and making sure that the patient receives the medications, takes the medications, even if she's not feeling anything. So patient adherence is so important in the management of lupus. The rheumatology lupus nurse will be able to, dedicated nurse will be able to provide that gap and emphasize to the patient why it is so important to adhere to medications. So these are the ongoing advances also in management. So not just medications, but also in the overall care and holistic care of lupus patients.
Yes, it was really an interesting point of view. Ideally, we would have multidisciplinary teams with other healthcare professionals, but it's not easy to have that. But the nurse can really fill the gap, as you said. It was really a good perspective. And this was, I must obviously agree with you, this was really a new thing on the Lupus Academy meeting. And one of the other things that I think you may comment more on this, that have been going for the last Lupus Academy meetings, is some tables for discussion of other autoimmune diseases that can overlap or mimic lupus presentations. And one of the presentations was the Dr. Raquel presented the new ACR-EULAR antiphospholipid classification criteria. Ricard, You know these criteria very well. And what do you think the main difference of these criteria to the last ones, to the previous ones? And how do you think that these classification criteria will change our practice?
Well, certainly many patients with lupus, between 20 and 30% of the patients with lupus can have the antiphospholipid syndrome, and it is very important that the lupologists are aware and knows this condition. And the new thing that is that we have just recently released the new ACR Euler criteria, and we were very happy that the person who led this process of creation and validation of this classification criteria, Doru Kerkan from New York, was at the Lupus Academy meeting to present these criteria. Actually, I have to tell you that these are probably more classification criteria for research, for registries, probably for trials, that for the clinical practice, then for the daily clinical practice. The first thing is that these criteria, conversely to the previous criteria that were done in a experience-based medicine fashion, these new criteria were done using a very strict methodology, following the ACR and Euler request for this creation of classification criteria. That is the same system that was used very recently for the new classification criteria of lupus. And this probably will have much more specificity for the detection of the antiphospholipid syndrome. But the sensitivity, that it's probably what we need at the bedside or at our outpatients clinics in front of a patient, probably will not benefit from these new criteria. The first difference regarding the previous classification criteria is that we need an entry criterion similar to lupus, that is the presence of antinuclear antibodies. In the antiphospholipid syndrome new classification criteria, the entry criterion is the previous classification criteria, just to have one clinical classification criteria plus one positive test for antiphospholipid antibodies. But then we have different domains, both clinical and laboratory, with different clinical manifestations and laboratory manifestations that have a different weight, different points, different scores, between 1 and 7 points, depending on the manifestation and on the laboratory feature. And in order to classify as antiphospholipid syndrome, you require 3 or more points from the clinical criteria and 3 or more points from the antiphospholipid, from the laboratory domain. An additional thing is that this new criteria requires more time to analyze if the patient fulfills or not the criteria, because you have to check very careful the different definitions of the different clinical manifestations, also the different definitions of the different laboratory manifestations, and this probably will be really useful for the research activities. But at this point, I think that for our daily clinical practice, probably will not be really of daily use.
Let's wait for new research on these also. And we could be going on with the discussion on everything that happened with Lupus Academy. We had a plenary on pipeline and potential SLE therapies that JAK inhibitors were discussed, plasmacytoid dendritic cells as a target treatment, CAR T therapy, and another round table or plenary on other autoimmune diseases behind SLE, like autoimmune encephalitis, interstitial lung disease, and this systemic capillary leak syndrome. But if we would go through everything, we would be here 3 days as in the meeting. And actually, if you that are listening to us want to feel this, you need to register for the next Lupus Academy annual meeting. So, Sandra, Ricard, do you have anything to add on the Lupus Academy meetings?
Well, I have to say that we were very happy with this meeting. We managed to get a lot of people from all over the world after the pandemic. So that's good to have everybody on board again. We were very happy to discuss during these 3 days on complicated lupus issues, complicated lupus patients, and we hope that for the next year, that the meeting will be done in Amsterdam. We will have also a very, very good program with a lot of interesting topics to be discussed.
Sandra, do you have anything to add?
And as you mentioned, there is never an end to lupus. When you talk about lupus, there will always be something new coming in from around the corner, and we all look forward to the next Lupus Academy meeting next year in Amsterdam.
Ricard and Sandra, thank you so much for joining me today, for having hosted this meeting and sharing today your insights. To our listeners, we hope these discussions have helped you gain more of an understanding of the Lupus Academy's latest education in lupus. Please download the Lupus Academy's 12th annual meeting report from our website. A link can be found in the show notes. Thank you so much for listening. We hope you enjoyed this podcast. Please leave us a review, which will really help us in reaching as many of your colleagues as possible around the world.